My name is Karthik. Today I am going to present the assignment for managing machine learning projects, and the problem statement we are going to take today is predicting next day discharge of patients in the hospital. Can ML help in this problem? The answer is yes, because hospital typically have a large amount of historical patient data that can be used to identify patterns and predict the discharge of the patients. Typically, this may not be easy through the traditional way of prediction. And the opportunity evaluation, the first one would be accurately managing the beds, which can ensure that beds are available for the incoming patients, and this can lead to more efficient use of hospital resources. Next one would be effectively managing the hospital staff, allocating nursing and supporting staff for more effectively. Third one would be like enhancing the patient flow by predicting the next discharge accurately. The last one would be eventually all these things would contribute to the minimizing the length of stay and associated operational cost. On the business understanding, the target users and the use case for this model would be hospital administrators and management. They can use it for optimal resource allocation, operational efficiency, and even strategic planning for the future infrastructure. The nursing staff can use this model for better care coordination, managing their workload, and eventually for a discharge preparation. And finally, patients and their families would get the enhanced care experience and a better post discharge support. The expected business outcome of this model would be like increased bed occupancy rate, which would maximizing the utilization of hospital capacity, uh, um, uh, efficient staffing, better planning and allocation of the staff, which would reduce in overtime and improve staff satisfaction. And then decreased average length of stay and effective use of resource, which can significantly improve the cost saving for the hospital. And finally, better patient outcome and patient satisfaction. On the outcome metrics, this model would help to reduce the average time taken to prepare the beds for the next patient and eventually decrease the average length of stay of the patient, improve the patient satisfaction score, and finally achieve the better operational cost. And what are the output metrics we would measure is the percentage of correct predictions done by the model, and the proportion of the false positive and the false negative rate, and finally the percentage of hospital departments actively using this model for predictions. The potential factors that would be relevant for this model would be patient demographics and medical history like age, gender, comorbidities, etc. The current health status and vitals for the patients with the lab reports and scan results, etc. The treatment and medical interventions like the current medications, therapies the patient is taking, and hospital and the environmental factors like the level of staffings and the discharge policies of the hospital, and finally the seasonal and temporal factors like the seasonal variations and what day of the week and what time of the day the patient is getting discharged. On the validation plan, the first one would be like it is important to validate the data to make sure the data is accurate. And we are using a variety of data covering all the scenarios. And the veracity, we are using the real world data for model training. Second one would be the model validation. Need to check the accuracy of the model. And the third one would be like we need to validate the model using data from different time period to ensure the stability over the time. And we need to make sure we involve clinicians, nurses, and administrative staff to review the model predictions. And finally, we should also continuously monitor the model's performance with real-time data, and periodically we need to retrain the model. On the ML system design, on cloud versus edge, it is preferred to be cloud-based because it's more scalable and we can use high computational resource considering the large volume of data involved. But at times, if hospital uh, is not comfortable to sending the data outside of the hospital, then we might need to go with the edge. On offline versus online learning, the offline learning would be preferred. It is simpler and it's implement and there is to implement and there is no need of online learning in this scenario. Finally, batch versus online prediction. We could go with the batch prediction. The prediction could happen over the night, and eventually the next day it would give time for the hospital staff to plan and coordinate the discharge process more effectively. The potential risk involved in production is, one is the data drift. There could be a change in patient demographics or health conditions, and there could be an update in hospital policies or protocols related to discharge criteria. On the concept drift, there could be a new medical advancement coming in. There could be new medications where clinicians might consider while determining their discharge readiness. The external factors like unforeseen events such as pandemic could impact the model. And finally, handling the sensitive patient data is key to make sure that the data is compliant with all the healthcare regulations. Thank you.